Yeah, obviously, we still work in the hospital. I'm in there every 4 weeks, and when this broke out in early March, it was a disaster. The hospitals were didn't have protection for their nurses or their doctors. They didn't have masks. They didn't have appropriate. And these people are coming in with COVID-19. Their blood sugars are 500. And very, obviously, the nurses didn't want to go in to prick their finger. And as a result, the mortality in people with diabetes was 4 times greater. And this is just a disaster because people aren't managing their glucose. And a lot of people out there are in poor control, and they come in and these are typically obese type 2s, but there are also type 1s. But the other thing we found in our trial, and we also have we've published a paper on this, is that if you come into the hospital and your glucose is up, but you have no diagnosis of diabetes, their risk of mortality is 7 times. So people with poorly controlled diabetes is 4 times mortality. If you come in the hospital and your sugar's above 180, consistently your mortality is 7 times. And this was done with the Glytech hospital systems that we looked at. And so obviously you need to control glucose, especially stress hyperglycemia, and that's very important. And so right now we're telling everybody you need to get your act together. You need to control your glucose, whether you're type 1 or type 2. We also showed a study today also that's being shown. It's a study using glucomanner outpatient titration. And so what we did there is we took people that were above 8%, their average was up around 11.4% average. And most people won't prick their finger. So we took the Abbott Libra and we had them, because we wanted to take Abbott Libra and so we could get their data. We got it on their phone. They sent us up to the cloud, and we were able to adjust both basal and bolus automatically with just four titrations over a 6 period. And we were able to take people from 40% time in range up to 75+% time in range. You went from an average of sensor glucose after the first 2 weeks, they were at 196, and at the end, they're at 146 with no hypoglycemia. So we need to find ways to control blood sugar, especially in this COVID-19. You really need to have people get on insulin, get titrated, get it to goal. You can use something like Abbott Libra, you can use a Dexcom, you can use a Guardian, and whatever. It's easy to do. And then once you break the glucose toxicity, you can then put them over to a GLP-1 or an SGLT2 with it to really improve diabetes control.